All right, let's switch gears now and focus on the topic of conversation today, and that is all about uterine fibroids. And I know this is a term that probably you've heard over and over again, but sometimes people don't really understand well what uterine fibroid is all about, who is at risk of the same, and what if left untreated, what could happen. So that is what we'll focus on the discussion today. So you want to stick around until the end of the show, but just a quick reminder of the question of the day, and that is, have you ever had fibroids and got treated? Once again, have you ever had fibroids and treated? Feel free to share your experience with us. Or if you have fibroids right now, probably going through treatment or not, feel free to share your experience as well with us at NTV Kenya at Lubeme_Winnie. Remember to use the hashtag YourWorld. But if you want to call in, probably have a question for Daktari, feel free as well to do so. The numbers are down on your screen. And by the end of the show, hoping that we'll have learned more about uterine fibroids. But to help us with the conversation, we have Fatma Mohammed, who's the founder, WellnessKE. Thank you very much for making time for us, Fatma, this morning. Appreciate it. And we also have Dr. Johnston Miheso, who is an obstetrician and gynecologist. Thank you very much, Dr. for coming by today. And we also have our very own Agatha Lenjo, who is a TV producer right here at NTV. Thank you very much, Agatha, for coming by today to share your story with us. Now, before we hear Agatha and Fatma's story, Dr. can we just start with you in terms of the uterus, just understanding a woman's reproductive structure, if I can say, and mostly dwelling on the uterus. What does it look like, and what exactly is it?
So the uterus is the main part of the reproductive system of the woman. Mm-hmm. There'll be the cervix at the bottom and the body of the uterus at the top. Okay. So it has two parts. Mm-hmm. And below it we have the birth canal or vagina. Mm-hmm. And then it has two tubes, okay. Fallopian tubes, mm-hmm. which transport the eggs from the ovaries. Mm-hmm. So the ovaries, tubes, uterus and birth canal form the reproductive system of a woman. Mm-hmm. It generally measures about 7 by 5 by 3 centimeters. So it's a tiny organ, it is. But it expands to accommodate a baby
who's a whole human being.
Could even be 4 or 5 kilograms.
Yeah.
So it's a very dynamic structure.
It really is. It really is. But at the same time, it's also prone to, again, a lot of things, infections, well. And diseases as well. And of course, one of the things that we'll be focusing on is on uterine fibroids. So what exactly does that mean?
So uterine fibroids are innocent or benign growth of the smooth muscle of the uterus. Mm-hmm. That means they're not cancerous. Mm-hmm. And they can grow at any part of the uterus. Mm-hmm. And they can grow to any size as well. Okay. So they define sizes and the position on the uterus. Okay. But just generally growth on of the muscle of the uterus. Okay.
I like how you say they are innocent, but really, really cause havoc.
They really do. I think the innocent means they are not cancerous.
Yes. Yeah. All right. And we'll also focus on the same in just a moment and just understand the different types, of, again, fibroids, where they are located and what sort of damage they can do, to a woman's body. But Agatha, let me start with you. So you were diagnosed with fibroids late March 2021, right? And I've seen the pictures and they are big, okay? Yeah. So can we just go back to even before diagnosis, right? How were you feeling any sort of way, and what made you actually go to the doctor to just understand, hey, maybe there's something wrong that needs to be checked?
All right, so in my 30 years plus, mm-hmm. I didn't know, mm-hmm. actually I've never visited a gyna. Okay. So last year, around March, mm-hmm. I was feeling sick, mm-hmm. just the normal bacterial infection like that. Yeah. Mm-hmm. So I went to the doctors. So after doing the blood test, of course, he was there trying to examining me mm-hmm. and all that. Mm-hmm. Then he noticed my tummy is very hard below my abdomen. Yeah. It's very hard, mm-hmm. and it's moving. So. Mm-hmm. The doctor is like, are you pregnant? I'm like, no, I am not pregnant. Yeah. Are you sure? When was your last period? I was like, no, I'm not pregnant. My last period was like a few days ago and all that. Then he's like, okay, for us to see what really is, mm-hmm. let's do an ultrasound. Okay. So he sent me to the ultrasound room. Mm-hmm. So when the sonographer was busy doing what they do, mm-hmm. then he saw like a very huge 3 actually very huge fibroids. Yeah. So it's like you have 3 big fibroids and small ones. And I just started crying at that time.
Yeah, I can imagine.
Because I didn't understand what are those. I'm like, are they going to affect my fertility journey?
Yeah.
Am I going to lose the man of my life? Am I going to be a mother? Or if I conceive, will I carry a baby to full term?
Yeah.
So when I looked back, I had very heavy flow. I could change every hour. And if I'm not careful, I used to soil my clothes every now and then. And the cramps were very painful. Like I could be so weak. I just want to lie in bed. So I was on painkillers. And also my blood levels were very low during my periods. So when I look back, I'm like, okay, I wish I knew that the heavy flow means something is wrong. But to me, I thought it's normal for a lady to have heavy flow.
Periods. Yeah. I hear you. Because I wanted to ask, like initially before you went to the hospital, of course you went to the hospital for something totally different. That is a bacterial infection. But before that, so your periods were very, very heavy. But is that how they were? Like, were they heavy and then they became heaviest? Or were they just like a normal flow and then all of a sudden became heavy?
So while in campus, they were also heavy. So maybe I think they started growing at that time. So they were heavy, but me, I was like, it's normal. I could share with my friends. My best friend during campus, we used to stay together. So for her, she would use, I don't know, like 3 or 4 pads the whole time, and me, I'm there using packets and packets. She's like, are you okay? I'm like, yeah, this is how I've been. So at that time, it didn't cross my mind that something is wrong with me. So me, I just knew it was normal. But now when I, like few years, like let's say after campus working experience, so around 28 there, 30 is when now it got worse. Okay. It was like someone opening a tap and yes.
And Dr. just listening to Agatha, because again, didn't have like major symptoms that you realize, apana, maybe there's just something going wrong. Because I think that is one of the things that so many women would say, that my periods became heavy and I thought, see, it's normal, change of weather, maybe whatever I ate or something like that, that maybe made my periods to be a little bit heavier than they usually are, right? So is this something that we should be cautious about, and that is maybe change of flow in terms of your periods? And also Agatha said, I never went to a gynaecologist until that time where I went to see a doctor for a bacterial infection.
So fortunately or unfortunately, fibroids are usually quite silent actually. Majority of women have no symptoms at all. That's why you're telling us about the chance of about 1 in 5 women have 1 in 2 actually have fibroids and they are not aware. So majority of women will actually live through life not knowing that they have fibroids, unless you're visiting a gyna for a different reason, and then they'll now check you and realize there is something growing. And then a majority of women, the symptoms are quite subtle actually, like Agatha's. So you don't realize something is happening. The periods start slightly getting painful or heavier. But you think, this is how I've been for the last few years. So unless you actually have a check, you would not know. So it's something that can start very, very slowly. And sometimes they're there and they don't cause any symptoms at all.
So you don't even know that you have them?
You don't even know that you have them.
Not unless maybe go for visits, maybe they can repeat.
But again, we recommend that a woman visits a gyna at least every 3 years, at least for the pap smear, and during that interrogation, you might actually pick up something. Majority of the time when you pick them up, we don't actually act on them because the majority are not causing any trouble. So we just ignore them.
I think it's because of this fear that not only Agatha, but like so many of us women have, that what if I go to the hospital, see a gyna, and then I'm told that this, we have that fear that something could be wrong. And sometimes we're not ever ready for that, to be told that something is wrong, especially in our reproductive, area, if I can say that. Okay, and then, so for you, Fatma, again, you were diagnosed, 15 years ago?
Yeah, I was diagnosed 15 years ago. I was 21 years old, and unlike Agatha, for me, I had no symptoms, but also it was quite tiny. It was a very tiny fibroid, and I remember the doctor telling me it's the size of a pea. And then the only reason I went in was because I used to work out a lot, but then I would feel something on my abdomen, something really hard, like a mass. So I was like, I need to go and get this checked to find out what this could be. And then when I went in, the doctor asked me some questions, and I had no symptoms. My periods were normal, everything was normal. But then he was like, okay, let's just do an ultrasound to just check what it could be. And then that's when they found out that I had the fibroid.
All right.
But the thing is that at that time, if I had the knowledge that I have now, it would have been different, because I think in Agatha's case, even when she was in uni, it's because her estrogen levels were already high, because that's why she was having the heavy flow. So from Kitambo, so meaning they were high and they kept on, you know, like she had excess estrogen, and then it ended up causing her to have the fibroids. So I feel like if women already know that this could be an indication from a very early stage, you could actually you know, you can be able to actually avoid any issues, because eventually for me I ended up having 23 fibroids removed. So it started from the pea-sized fibroid to that. That's why I feel like it's important.
What? Like by the time
I had them removed.
Get to,
Yeah, but that's because when I went in and then the doctor told me, you have no symptoms, and I'm sure Dr. will confirm, they normally tell you like, we'll just do this watchful waiting. So you have no symptoms, let's just wait and see if anything is going to happen. But I realize now that watchful waiting will only work if you do certain things. If you really are careful about your hormones, you know, your estrogen levels, you know what you're eating, you know that you're exercising, you're avoiding stress. And so because everyone lives life normal, no one is perfect and they do all these things.
Absolutely. No, especially when it comes to the stress
I
thing.
know.
Sometimes you don't even know that you're stressed.
You cannot. And you're still in your reproductive years, meaning you're still going through menstruation, so you still have a possibility of having fibroids. So the watchful waiting part, I feel, will work for any woman who right now maybe has been diagnosed and it's a tiny fibroid and has been advised, then she has to also go in, get a hormone test, eat well, exercise, and really live a life of wellness.
So and we'll focus on, you know, the whole aspect of treatment options for different women. So for you, pea-sized, right, at age 21. So by the time they get to 23, that are being removed, like in a span of what time?
Many years, because you see, every time I would go in to have a checkup, because now I knew I have this fibroid, right? So I have to go constantly to the hospital, same doctor, and then the second time I went in, there were 5. And then I remember telling him like, okay, they have really increased and it's in a short, you know, number of years. It was like 2 years they had already increased. And then, so he advised me like, okay, now that there are 5, you really are going to have to do something about this. And I was like, so what do I have to do? And he
then
said,
at 21.
Yes. And he was like, no, then now that they're 5, we're going to have surgery. We have to remove them. And I was like, but I came to you when it was tiny and I would have wanted to avoid that. But then, you know, the confusion and everything, I had to now try and find a way, because just like any other woman, I didn't necessarily want to go through surgery. It's something really scary. So I wanted to try and find a way that I can be able to either shrink the fibroids or to just get better. But then, you know, when it didn't happen, that's when I had to have them removed.
Okay, then. Okay, so Dr. Terry, a lot of things. Fatma's case, it was like a pea size, very, very tiny, like you could hardly see it. Agatha's case, again, by the time she was going to a hospital, they were big, that they needed to be removed, right? So for Fatma's case, again, so how then do you notice it? Because you went to the doctor and then you said part of your abdomen was hard.
Yes.
And I'm thinking, but it was tiny. Like, so how are you able to pick it, and at what rate do they grow? Because again, for Agatha's case, campus, heavy flow, maybe that is when they started, maybe not, we're not too sure. But for her, 21, pea size, and then by the time she's going to a hospital the next time, they're like 5. So at what rate do they grow?
So the symptoms they present with depend on where they are.
Okay.
So I think you mentioned we would talk about that. So there could be 3 positions. One on the surface of the uterus, we call that subserosal. There are those ones found in the middle of the muscle, we call them intramural. And then there are those inside the lining, on the lining of the uterus. Those are the ones that cause us too much trouble, because they increase the surface of the lining of the uterus, which causes more bleeding. That's why most of the time you pick those ones earlier. For majority of women, the others you won't even pick them at all. So again, they have different potential. Even in the same woman, the fibroids will grow differently. Even the one that grew to 10 centimeters, if it ever got there, is not maybe the one that was the pea size for you. So they can grow very rapidly, they can grow very slowly. They say a growth of average of about 7%. So if you found it at 2 centimeters, you can say 7% of that in a year's time. But they could actually grow even up to 30, 50%. They could actually multiply in a very short time. So they have different potential. And you can't say which one is going to be the biggest or which is going to grow fast. So the dilemma comes when you see one pea size one. What do? Do you offer surgery at that point? Because eventually you had 23 removed. So there were others actually. So if you remove that single one, you're going to have another operation for the others. So you have to individualize that balance. You have to look at an individual, discuss that with them. And most times you prefer to do nothing until we actually push. Because the danger is that you remove this 5 and then the next time you look there are another 5 and then there's another 5. So you are repeatedly going to theatre every 5 years.
Oh wow.
That
So someone like
uterus,
wait and see maybe again at work. So you said they grow differently. Could be fast, could be small. Slower, right? Are there things that maybe trigger for them to grow faster or slower? Or again, is it
generally fibroids respond to female hormones, so progesterone and estrogen. So they never actually occur before puberty because there are not much hormones at that point. And most of them occur between 30 and 50. But again, they respond differently. Everybody produces estrogen, progesterone, but not everybody has fibroids. So there are people who are prone to develop them. There are those who develop the ones that grow very quickly. There are the ones who develop the ones that grow slowly. You could have one small little 5 centimeter fibroid, which stays for the rest of the lady's life. So you don't touch that at all. But you have this small tiny pea-sized thing that's lying on the lining of the uterus and causing heavy painful periods, and you have to act on that actually. So we have to individualize the care we offer a woman.
All right. Okay. So Agatha, went to a hospital, the doctor says you have fibroids. Of course, there's confusion, there's denial, there's all these feelings and emotions that one has to go through, right? So then what happens next?
So at that time, the sonographer told me I should go see a gynecologist. And remember, my 30-year plus, I've never seen a gynecologist. It's the first time. So I'm like, okay, who is the best gynecologist? And then I texted my sister. My sister's like, don't worry, everything is going to be fine. We'll ask for referrals. So we asked different people for referrals. And I got one. It was a very good gynecologist, Dr. Ongech. So I went there. So he also did, of course, his test to examine. And then it's like, for now, as in we need you to do surgery ASAP. Because at that time, my blood levels were 8, 9 there. And I was still bleeding. I was having a flow. So he put me on medication to stop the flow. And then he told me, we can't go to surgery with your levels like that. Go home, do or eat things that are going to increase your levels. Of course, he gave me the vials to increase my levels. And then after 2 or 3 weeks, so now that's in April, we scheduled the surgery for April. So at that time, yes, it had risen, but not as much. But he's like, we still need to remove. So when he removed, there was one big one. One big one, like it looked like a 3-month-old. And if you have the photos, you can.
Yes, we have the photo.
It was one which is big. Till today, I still can't understand how I was carrying such in my body. And then there were small ones, like 7. So in total, they became 9.
Because when I saw the photos, like, I had so many questions for Agatha. I was like, were you feeling heavy? Was it heavy? Was this, because it's a lot. And just looking at the picture and how big it was, it's a lot of questions. So you were told to eat. Things that might help you. Did they help? And what did you have to eat?
At first, I used to do the smoothies with beetroots, with dates, and then at some point I bought a ½ kilo of liver. I decided I'm eating that kilo within a weekend, Saturday and
Saturday. So breakfast, lunch, dinner, breakfast, lunch, dinner.
Exactly, and also the vials which I was given, so I was also using that. So
did they help much?
They increased, but not to the level of
that
the
was
normal.
Expected.
But they did, but of course during the surgery I also lost blood, so I had to be transfused.
Yeah.
Yes.
Okay. So do you try and just understand, are there different options to this? Can they probably do something to shrink it, or surgery was the only option for you?
Okay, yeah, there are different options. Like the gyna explained all the options, but as for me, since they were big, the only option was just surgery, myomectomy. It's like a CS, they open you.
Yes.
Yeah,
and then remove all the
There are other options of either doing laparoscopic, which is non-invasive, and also maybe for shrinkage.
Yeah.
But for mine, I was just told, hey,
the only option was
surgery, because I looked pregnant. Yeah, I remember people here at work that tell me, oh, congratulations, you're pregnant. I'm like, no, I am not pregnant. When I walk into a building, the security guys are telling me, no, don't use the scanner, just
what's it?
the side. I'm like, I'm okay.
I am not pregnant.
Yeah, so me, I thought maybe it's because maybe I was eating a lot of junk food, like pizza. You see, it has wheat, so I thought, maybe wheat is making my tummy.
Yeah.
But when I look back again, there's a time I tried exercising and I'm like, I'm not losing weight. And I know every time I exercise, I normally lose weight. But this time,
it is not going
it's not going anywhere. My tummy is still big. But it didn't cross my mind that I am carrying things.
Fibroids. Yes. Okay. And again, given what we said earlier on, of course, Dr. Johnson said that sometimes you don't notice because you know, so the symptoms could be so mild that you confuse it for change of weather, this or that is making me to gain you know, this much weight. You're carrying fibroids and you don't know. So Dr. given what Agatha is saying, and this can have like a lot of effect as far as, again, your mental health, because and you're thinking, no, but I am not pregnant. So it's very easy for people to just sometimes say things based on the fact that they don't know that what is going on in a woman's body. So Agatha, for you, did this maybe cause like a bit of, you know, stress? You know, because every time it's like, congratulations, you're like, no, I am not pregnant, and then you also have to explain that I don't know what's happening.
So in the beginning, of course, I used to be stressed. I'm like, why? And then at some point I was like, okay, let me joke with them. They tell me I'm pregnant. I'm like, yeah, sure, I'm pregnant. And I'll deliver maybe in 10 or 20 months. I think that joking will help me, like not
take it like so much,
exactly.
Because at the time you don't know, and they also don't know.
So I just had to joke with them.
So then, what is approach? You know, to this doctor, I just not say anything, maybe to someone.
Yeah, as you said, the symptoms may not actually come at all. You may not notice anything. Some people notice a swelling of the tummy. Some people notice a change in bowel habit. Maybe they're getting more bloated or things like that. And we can always explain that. You always say, maybe I ate something yesterday, or I'm putting on a bit of weight. So there are a lot of other things that are happening in your life, or I'm stressed, as you're saying. So you can actually always explain your symptoms away without even going to the doctor. And that delays the diagnosis. And I think what the message would be to get a regular check, so that you know where you are. It's not necessarily going to lead to an intervention. We might not do an operation, but to just know where you are from the gynae point of view. So a simple examination would tell us whether you have a fibroid or just a scan. And when you're having a pap smear, somebody will actually detect if there's any change in the normal position of the uterus or something like that. So
doesn't matter how scared you are, just please go.
I think so.
At least, like you said, once in 3 years, see a gyna and just see what happens. Okay, so Agatha, I know you have to leave us in a few minutes, but please don't. Let me just speak to Fatma very briefly, and then I'll come back to you. So Fatma, the next time you went to a hospital, door 5, and then here you are, what do we do as far as then removing them or not, weight and all those things? So then at what point did they get to 23? Did you have like constant visits during this period?
Yeah, I had constant visits because this was something new that I didn't really understand was happening to my body. And then naturally I'm very inquisitive and I like to learn. So I was doing a lot of research to understand why every woman that is diagnosed with fibroids is told they don't know where they come from, there's no treatment, but then you just have to figure it out. And then your only option is usually surgery. So during that time when I was doing a lot of research, I was trying different things. I was trying, you know, like to eat better, I was trying to exercise and stuff. But then I remember I had, you know, different jobs, and I can say stress was one of the biggest factors that really got me to that point. One of the biggest, because every time I would be in any kind of stressful environment, stressful job, I wouldn't feel okay. And then I started now developing the symptoms. Now I started having the heavy menstrual flow. I became anemic from the heavy flow. I also had a really like protruding belly where everyone just knew I was pregnant, much like Agatha. And then every time I would go into the hospital, unfortunately, now I had to switch doctors because I was like, this one, it's not working. Let me try somebody else and somebody else. So I had second, third, fourth, fifth opinion. But then the problem is almost every other gynecologist told me, oh, we're just going to have to do a hysterectomy. We have to remove your uterus because these fibroids are too large, because it went from 5 to 7, from 7 to 9, 9, 11. And then when it got to 11, I was like, no, something is not working.
So because at this point, so 11, right?
Yeah.
How big are they? How small are they?
Very big.
Very big.
Very big. And I think the smallest was about 11 centimeters. So really big, a lot of pressure. I had back pain, pelvic pressure. I would pass out from pain. So I was like, it was like a constant battle. And then every other day was a new symptom. And by the way, Agatha, when you mentioned about bacterial infection, majority of the times you'll find women who are diagnosed with fibroids, before they're diagnosed, they actually have bacterial infection. And I would have almost every month. Sometimes I would have twice a month. And I would have to be rushed to hospital, and then they would have to, you know, need treatment for me. But just the whole process in itself was really, really stressful, because I'm doing the right thing, but nothing is working. And then eventually I was like, I cannot have a hysterectomy, because I really believe if I did the right thing, I shouldn't be here. So after, you know, going through different doctors, unfortunately I ended up having deep vein thrombosis. So I ended up having a blood clot. And I remember I asked many doctors, I asked them, why do I have a blood clot? I did not get an answer, but there was one doctor who said, I think it's because your fibroids are large, so they're disrupting the circulation. But then after I had the surgery, I discovered that women who have high estrogen levels have issues with circulation. So if there's a woman out there who has been diagnosed with fibroids or issues like PCOS or endometriosis, and you know your estrogen levels are high, make sure that you are very careful about also your circulation. Make sure that you have some form of physical activity. Make sure that you also go for regular checkups, and if you can, make sure that you get a hormone test as often as you can.
All right. It's a lot to unpack, because again, 5, 7, 11, and all this while, of course, they are increasing in size. At the same time, every single day, it's like a totally new symptom, right? And you know, for you, Fatma, you might ask, but I'm very active. I am very, you know.
Very fit. I was actually training in martial arts. I remember I was very fit. I was also doing my best to eat healthy. I was doing my best. And also, I think when it comes to fibroids, you have to approach it from a wholesome point of view. Because majority of the times when women are diagnosed, they really want just that one pill. What's that one thing I can take, and then they go away?
Or just
but then as they say, how you get it is how you lose it. If you go down that route and you're given this one thing to just solve this one thing, you're not necessarily going to prevent a reoccurrence. Because unfortunately, yes, you've gone through a myomectomy, but then ask, why did I end up in this place, in this condition? Maybe it's your genetics, maybe it's family history, maybe it's your diet, maybe it's your age, maybe you had early menses, maybe you're going to have late menopause. All these are risk factors for women to have fibroids. So I think it's important for women to
understand. I know we have like a minute to go, Dr. And I'm not too sure you can answer this in terms of that, who is more at risk of developing fibroids? And you know, for so many women, once you're told that you have fibroids, the first thing is, what did I do to make this happen, right? So can you answer this in like a minute? Do we know what really causes fibroids?
I think the short answer is no.
Okay.
But they are commoner in the black population, Afro-Caribbean population. They tend to run in families. So there's a sort of familial pattern.
Genetic composition to the same,
familial run in family. If you have early menarche, like you have the first period early, or the late menopause, the change, you are likely to get whatever. So the more exposed to the hormone you are there, the more likely.
Yeah.
And if you're obese, like your body BMI is high, that means you're producing more estrogen and progesterone, so you're likely to actually grow them faster.
Okay.
But that's not the whole story. Again, there are obese people who don't have fibroids, so there's also an individual predisposition.
Yeah. Okay. All right. So let's take a break. But of course, when we come back, we'd want to understand how early is early, because right now we're seeing young girls as early as 9, 8, starting their periods. So how early is early? And then the pain levels, because Agatha said painful that sometimes you just want to lie down, right? So how early is early? The threshold, pain threshold, because there's so many women out here who probably struggle with very painful periods and don't know that maybe it could be fibroids or a symptom of fibroids, all right? So let's take that break. But of course, when we come back, we'd also want to take a look at your feedback as far as what we're asking you today, and that is, have you ever had fibroids and were they treated? So we'll see you after the short break. Stay with us. All right, welcome back. Glad you're still with us. The show is Your World, and today it's all about uterine fibroids. A lot of insights that we're getting as far as uterine fibroids is concerned, but I know there's a lot of questions that Dr. needs to answer. But if you still have more questions as far as uterine fibroids is concerned, feel free to either share your experience and your question as well with us on at NTV Kenya at Lubembe_Winnie. Remember, we're also asking you, have you ever had fibroids and they were treated, or were they treated? All right, feel free to share your experience with us. That is, have you ever had fibroids and got treated? And if not, also feel free to share your experience with us. But if you want to call in and also share your story with us, or ask Dr. a question, or any of these ladies that we have on the show today, feel free to do so. The numbers are down on your screen. And before I ask you a couple of questions that have been forwarded, Dr. That question of pain and the threshold, right? Like, how painful is too painful to make it not normal? Because I think a lot of us women, especially during your messages, are like, yeah, it's really painful, take a few painkillers here and there, and that's it, right? So someone like describe this pain to us.
So pain is a subjective complaint, and people perceive pain differently, actually. Somebody might have very mild pain and they're screaming, and somebody has a lot of pain and they're just quiet and they're not saying anything. So the other problem is that periods could be painful by themselves. We call that primary dysmenorrhea, where just periods are. You produce hormones called prostaglandins, and when you're producing lots of those ones, you get pain. So even if you went, probably a good idea to have a scan to just check that there's nothing else causing the pain. But a lot of girls have that, and we have treatment for that. But some women actually will have pain because they're now having a lot of fibroids, and they're producing more of those hormones. So pain is a difficult one. Everybody has their threshold.
Exactly.
And then there's back pain as well, just pressure now on in your pelvis. So pain from the fibroid is different, back pain is different.
At what point do they come in, especially the back pains? Because there's some people who probably never experience the same, and others maybe start experiencing the same after some time.
So again, the site of the fibroid, the size, so where it is on the uterus matters. Some of them are actually lower on the cervix, and those are just cause direct pressure in your pelvis. Some of them are on top of the uterus, and they actually grow up like a pregnancy, and you might not get any pain at all. I think that's what Agatha had. So it depends on where they are and the size of them as well.
Okay. And Agatha also mentioned that you used to be full, like almost all the time. You're not hungry.
I could eat a small amount of food, then I feel like my stomach is stretching so full. It was so uncomfortable. And I was like, Ama nime overeat.
And you've eaten like this much.
And I've eaten a small quantity. Even people are you sure you're eating? I'm like, yeah, eat and nishibisha niko tu sawa. Then it used to be very uncomfortable. I would stay like this. Clearly, it just looked like I was pregnant. I was behaving as if I was pregnant. Because I think mine was on top, the way Dr. said, also my gyna said, because it pushed everything up.
Exactly.
Exactly.
Yeah. All right. So then, Dr. So let's answer these questions a lot. So the first question is does lifestyle actually contribute to fibroids, and also contraceptives or family planning? Do they cause? The first one is lifestyle. Does it contribute to one's chances of getting fibroids, and family planning, or let's just say contraceptives in general?
So we've said that they respond to hormones. They're actually a result of hormones, and the hormones are estrogen and progesterone. So lifestyle will contribute in the sense that if you're not living a healthy lifestyle and you're putting on weight, you're likely to produce more hormones than somebody who's normal BMI. So you're likely to get more fibroids if your body mass index is higher. And contraceptives are actually protective. Because what contraceptives do, they suppress the internal hormones. So they sort of impose a cycle on the woman, and that way they actually silent the growth of hormones. The same thing that pregnancy would do. Again, when you have whatever pregnancy, you have excessive hormones, so you tend to stimulate them. So some people actually tend to grow faster in pregnancy because of excessive hormones. So contraceptives tend to quieten them up a bit.
Okay. And then also another question, does it affect intimacy, and in this sense, intercourse?
So it does actually, and as I said, it's the position of the fibroid. So if it's lower in the cervix, actually people have pain during intercourse. But if it's high up, live a normal life actually, and you have no clue what is happening. The complaint Agatha had is actually pressure on the bowel and on the stomach. When there's pressure on the bowel, it slows down and you feel bloated and you feel constantly full and things. But again, if you have any discomfort in your pelvis, in your tummy, intercourse is actually almost a no-go zone, and you really need to start looking for answers. There might be something going on.
As soon as possible. Okay, and then someone else asked, I think this is a question on recurrence and how do you prevent, the same. But I think we'll focus on this because I also have a lot of questions in terms of what are the chances of recurrence. Are there people who are more at risk of experiencing a recurrence as compared to others, or once they are removed, that's it, given a clean bill of health, right? But before that, so then that question of, fine, we do not know what really causes it, but there are lots of risk factors as well. Is age a factor? Because Fatma said, I was only 21, relatively young. And also for Agatha's case, I think when you were, in your 30s, right? So is age a factor when it comes to who might be at risk of getting fibroids?
So age is actually a factor, and majority of women get them after 30, between 30 and 50. And it's actually how long you have been exposed to the hormones that we're talking about, estrogen, progesterone. But then you have people who have been exposed to them for 2 years, and then they start also developing them. So individuals are also different. That's why we said if you have periods at an early age, maybe below 11 years, you're likely to get them. And if you delay, your menopause delays to 55, you're also exposed to hormones for a longer time. So age is a factor.
It's a very big factor. Okay. So age, like below 11? That is the onset of your periods, you're more at risk of the same. Because I think initially when we were younger, we'd see 11, 12, 13, sometimes 14, 15. But right now we're seeing the onset of the same, where like young girls, like 8, 9, 10, probably start their periods. Why? Why do they start their periods very early?
I don't think I have an answer to that, actually. Something seems to be changing. I think Fatima alluded to that. Something seems to be changing in our lifestyle and something else. I don't know whether it's going to be lifestyle thing or diet or something, but we are all changing. So maybe with time it might emerge more clearly. But people having periods a little bit earlier than the olden days.
And also, Winnie, maybe I mentioned the fact that I think what the younger girls are eating now is not what we used to eat and what other. So I think also that also plays a part. People are more exposed to GMO foods and these chemicals known as xenoestrogens that are in the environment, in the products we use and things like that. And so eventually it means that they're more exposed to this from a younger age. And so you find that you even have younger girls, as we were talking with Dr. being diagnosed with fibroids from a very young age. And he was saying, if someone comes in and they're 18, how do you cannot suggest surgery, because by the time they get to 30, they might have a recurrence, and especially if they are already exposed to high estrogen. So I think it has a huge part of it is the change in lifestyle.
Which we need to be very cautious about, because even right now we're seeing like very young children, you know, struggling with overweight and others, you know, being obese.
Very true.
So again,
Very
lifestyle,
true.
I think we need to really look into that. All right, so we have a caller on the line, Delphine from Kisii. Good morning.
Good morning, madam.
Delphine, are you there?
Yes, nakupata.
Asante sana for calling us today. Do you have a question for Daktari?
Nilikuwa nauliza fibroid itaweza cause cancer.
Okay, fibroids inaweza cause cancer.
Alafu itaweza fanya tena mtu asione periods. At least I'm around 40 years and I've stopped my periods. Hivyo ndio nilikuwa nauliza.
So ulikuwa na fibroids, like were you diagnosed?
Nilienda wakati nilikuwa okay, I had it. Nikakaa nayo bila kupata pregnant. Alafu later nilikuwa na mimba, lakini daktari akaniambia sitapata mtoto vizuri, I have to go for CS. So nikaenda, wakati nilikuwa ninazaa wakanitoa, but still I feel that there is something inside, though I've never gone for test again. But I have a kid of around 7 years.
7 years.
And since that time when I delivered, I stopped my period.
Okay, after delivery. Okay,
Yes.
all right. And you said daktari alikwambia hutapata mtoto and then you got pregnant.
No, akaniambia nitapata mtoto.
Ukipata?
Nitapata vizuri normal, but lazima niende for surgery ndio wanitoe fibroids. So walinitoa, they were 3 of them.
Okay.
Aka mtoto kalikuwa kadogo, I think ni sababu ya hiyo zilikuwa zinakunywa damu.
Okay, so zilitolewa lini?
Zilitolewa around 7 years ago.
Oh, 7 years ago. Ukiwa na mimba?
Nilipokuwa na mimba, wakati nilikuwa na sana ndio walitoa.
Oh, okay. Oh, okay, fine. Sawa. Thank you very much, Delphine. Daktari, before you answer that, let's take a look at your feedback as far as the question that we're asking you. That is, have you ever had fibroids and got treated? All right. So let's hear what you have to say. So Yulen Kasandi says, you're making me afraid. My flow increased. I used to do it 2 to 3 days. Now I go up to a whole week. Do I need to go for checkup? All right. And then someone else asks, what is the cure? This is Uni Grandi. What is the cure? So 3 questions for you, Daktari. The first one was, can fibroids cause cancer? And can it cause one's periods to stop?
Swahili or English?
Either, it's fine.
So when I started off describing fibroids, I said they're innocent growth. So they actually don't cause cancer. And that's the most reassuring thing. They're just a nuisance, and they cause a lot of problems for women. So if you have a normal uterine muscle compared to a fibroid muscle, the fibroid is more or less likely to cause cancer than the normal muscle.
Okay.
So they're actually innocent. The second question for Delphine was about periods disappearing at 40. I think she needs a checkup actually. Fibroids don't cause that, they cause the opposite. Whenever you have fibroids anywhere in the uterus, you're likely to have more bleeding than less bleeding. She could be going through an early change of life or menopause. She needs to have that checked.
Okay. All right. And she also mentioned that they were removed, I think, when the baby was being delivered. So she had to go through CS as well. Yeah, and I think I also have like a lot of questions as far as when do they get removed? Especially if someone is pregnant with fibroids, at what point do you remove them? But before that, there's also a question of someone's flow being heavy. I mean, they used to experience their menstrual flow at between 2 to 3 days, but now they go up to a whole week, right? So she's asking, should I really go for checkups or
I
nothing to worry about?
She needs to do.
Yeah.
She needs to get checked actually.
Yeah.
It could be nothing, but again, it could be fibroids actually, as all seen, they could present in all different ways.
Okay.
So that requires a checkup to see why they change.
Yeah, and we see a lot of women, I mean, you know, all discussions, you know how as women have like discussions around these things, yeah? So someone is like, yeah, I used to maybe bleed for like 2 to 3 days, and sometimes now it's like up to 7 days, and we just think, oh, maybe weather, maybe food, maybe this, maybe that. So that is a subject of concern, especially if the flow increases in terms of like the amount and days.
Days, yeah.
Yeah, you have to go get checked.
Get checked, yeah.
Okay.
Yeah.
All right. So, and then that question of hormones, because we mentioned a lot of hormones, these hormones, that hormones there, hormones here, and some might be struggling to follow through, right? So help us understand in terms of like hormones and being hormonal and all those things. Can you just make it clear for everyone and how they might end up either helping or causing fibroids?
So there are 2 female hormones, estrogen and progesterone.
Yeah.
Male do produce but smaller amounts.
Yeah.
But these are the ones that drive the female cycle. They're the ones that make a woman produce an egg every month, and that's when they become fertile.
Okay.
But these hormones also stimulate the other things as well. So hormone fibroids are one of them. And usually the stimulus is whatever is for the growth of the reproductive system. But then fibroids escape that sort of control. Cells are supposed to be born, literally born, grow, mature, and then die. But this one's for fibroids escape that sort of process and then just keep multiplying and still feeding on the hormones.
Okay.
So if you control the hormones, you actually literally can slow down or stop the process of fibroids growing. But I've already mentioned that everybody produces this, but not everybody has fibroids. And everybody produces the same hormones, but not everybody, they don't grow at the same rate. So there's a lot of individual variation in hormones. But then there's something called hormonal, what you're referring to. And there's something else about how it affects a woman's general body, mental state, and things like that. Again, individual variations, and they could get into depression, mood problems and stuff.
Okay.
Yeah.
All right. So Fatma, again, got to a point where you just had to have your fibroids removed, right? But before that, were there like any other interventions that maybe you sought, maybe another form of treatment that you sought before eventually ending up with surgery?
I tried to. My only issue was every doctor wanted me to have a hysterectomy, and I did not want to have that. For those who are watching, that means they want to remove your uterus.
Yeah.
But since that was not going to be an option for me, I felt like I need to find a solution. But the only thing that happened was when I ended up being diagnosed with thrombosis. And, you know, thrombosis is something that's quite dangerous. So when that happened, that's when I got a really good doctor who said, you know, because of this thrombosis, we actually have to make sure that you have the, you know, fibroids removed. And something interesting for women to know is that sometimes you could go, you know, you get your ultrasound and the results might show a certain number of fibroids, but then you end up in surgery and they find that there are more. So you might think you have 2, but then you end up finding out you have 5 or you have 10. So then eventually is when I had those, the 23 fibroids removed. But I had tried to eat healthier. I tried to rest more. I used to try and do acupuncture. I used to go to different places. But I think it just had gotten somewhere where now it was just too much for my body. And again, my pain was a lot of pain, and I would pass out from the pain. So because of that, they felt now it's becoming a danger, and because of the thrombosis, so that's when I had to, you know, have the surgery. But there's something that Agatha had mentioned about the cramps. For women who experience really bad cramps, you have to also check your iron levels, because I did that. When I checked my iron levels, I found they were low. When I fixed my iron levels, the cramps went away. So sometimes because there's less blood, you find that the uterus contracts more. So they have to check their iron levels and eat foods that are more, you know, rich in iron, but then also do vitamin C with your foods, because vitamin C will help the iron be absorbed better. So if you're going to have spinach, then add cabbage in there, because cabbage has vitamin C. So if you're going to have, I don't know, beetroot juice, then make sure you have an orange in there so that it can be absorbed better in your body. So I think the only thing I would say is most women have not figured out about hormonal imbalance, and it's important that you get a hormone test, because like the lady who had heavy flow and then now she doesn't have her periods, her estrogen also is related to PCOS, and PCOS is also something that causes women not to have periods. So I feel like when women understand hormonal balance, they'll understand their bodies, and it stops being confusing. Because when you go into the hospital, it's just these words that are being mentioned to you.
Exactly, and then you get asked like so many questions, and you don't
And
even
you don't know
understand.
what's
You're like,
really going on.
me, I'm just going about my life.
I know,
you know,
but
normally
we have to make such conversations normal, such that women don't feel scared, because most women are scared to go into the hospital and discover what's going to happen. Because when you have knowledge, you can fix anything. When you know what you're supposed to do, you fix anything. So making this knowledge available to women is also really important.
Yeah. Okay then. So Dr. I think we were having this discussion during when we were on break, where what does it look like? Because I think for a lot of people, yes, we hear fibroids, we hear this almost on a daily basis, but just to get a picture of what exactly they look like. I was just sharing with my producer what I initially thought fibroids were. They were like, you know, this, someone looked like cacti, you know, how they're just like this. And I believe that is what a lot of people actually have as far as fibroids, right? So could you paint a picture for us? Because Agatha says, looks like 3-month-old baby, you know. So just paint a picture for us so that it's easier for all of us to understand. The next time you hear about fibroids, you actually somewhat have a picture of what it looks like.
So fibroids are generally round wools of muscle cells. Actually, they're generally round.
Yeah.
And they generally grow and have a capsule around them. So in fact, when you're removing, we take away the capsule and just peel it out. So they come out little eggs or different size pieces, as you're saying, and some as big as a watermelon actually, but they're generally round. So it could look like what Agatha was saying, a baby's head or something like that.
Yes. Yeah.
So bit of meat actually, if I can put it that way.
Okay, and we have Agatha's picture. I think when we're ready, we can show you, so we get a picture of what exactly they look like. And then someone asked, could they be cancerous? Which you said absolutely not. And then the aspect of diagnosis, right? Because like we said earlier on, most women would go to a hospital for something totally different, and then, you know, only to be told that maybe you have, or this could be fibroids, and we need to do a proper check on the same. But we have, you know, the picture ready, so Dr. probably like explain to us. Agatha is like, okay. So let's have the picture on so that again we can just get a better understanding. There we go. See this. Agatha, this is what you are carrying.
Yeah.
Looking at it right now, what do you feel?
Till today, like, I can't believe I was carrying that and the others.
Yeah.
And it's so chilling. I'm like,
It is.
Yeah.
Right?
Till today.
Yeah.
So at times when I don't have anything, I just go through it. I'm like, okay, peni metoka.
This is what I was dealing with. This is what I was carrying.
Yes, this is what I was carrying. But I am grateful that I got a very good doctor.
Yes.
Who got to remove all that, and I'm better now. Yeah.
Okay. All right. So, Dr. diagnosis. Take us through, you know, the whole process of diagnosis. What does it look like?
So diagnosis isn't as difficult as the presentation actually. I think because they're quiet, it takes us longer to pick them. But once you have a symptom, like the lady said, her periods have changed from 3 to 7 days, your mind is already looking for something abnormal with the uterus. So you take a bit of history. So how are your periods? When did they start? How long do they last? Are they painful? Do you have painful intercourse and things like that? So a bit of history can actually point towards fibroid.
This is fibroids,
And then we normally often do an internal tummy examination actually to feel whether there's any something growing from the pelvis. And then we do an internal examination.
Okay.
And when you feel, you can actually feel the uterus with your hands. So you can actually make the diagnosis without any fancy ultrasound or anything like that. Or make that suspicion. Now from there, when you suspect it's the fibroid, that's when you send a lady for ultrasound scan. And ultrasound scan are good in telling you this is a fibroid actually, but they're not good in telling you the exact size and how many. So often you say 3 and that time you actually have 5. So when you do a next scan, you think there are 2 more, but they were there actually, they were just missed or they were smaller.
Yes.
So we do have better imaging like MRI scan, which can actually tell you better how many you have. It's an expensive whatever, and usually doesn't add a lot of value unless you want to go a different way of treatment. So most times you just want to know whether it's a fibroid, the position of it, and the size. And we don't always recommend recommend that women have serious scans to check that. We know it's there unless your periods change or your symptoms change. So we go with symptoms rather than the sizes of the fibroids.
Yeah.
As I said, the size and the site are important.
Okay.
And that's what translates to symptoms. So if you know they're there and they're not causing any trouble, it's 18 years or 21 years, you want to actually wait and see what happens. They might not grow, well and good. If they grow, then you have to take action.
Okay. And then, so before we take a break, because we'll take a break in the next like 3 minutes or so, we have a caller on the line, Eliza from Muranga. Good morning.
Muranga, good morning.
Good morning.
Good morning to you.
All right, Eliza, can we ask that you reduce the volume of your TV so that we can be able to communicate? All right, so are you there?
I have a question.
Yes, go ahead.
I've heard Dr. saying about swelling of the abdomen and having prolonged periods and having painful menses. So for the last 6 months, I've been having this problem. And I went to Dr. for that problem of dysmenorrhea. Sasa nilipotumwa scan I was told niko na cyst. And the cyst zilikuwa zinasema ni 2 cm, I don't know by 3. Then I was put under some antibiotics for 5 days. Then nikaambiwa zita subside. Sasa for the last 6 months nimekuwa nikipata swelling of the abdomen na bloat, nisijakula kitu venye huyo dadi alikuwa anasema. Sasa my problem, my question was, might this be fibroids ama ni nini juu iko na, okay, for me I don't have prolonged periods, but napatanga sometimes I do sports, alafu na sometimes zina miss, like the whole of January I didn't have my periods, and then ile time ilikuja Feb I had very severe pain. Yeah.
Okay, all right.
So naweza kuwa niko na chances za fibroids because I was told nikimaliza hizo antibiotics given some green capsules nikaambiwa zita subside, hiyo cyst ita subside with time. But from kitambo nimekuwa nikipata hizo painful menses. Yeah.
All right. Thank you very much, Eliza, for calling us today with your question. Doctor, I hope you've noted that because we have another caller on the line, Purity from Sultan Hamoud. Good morning. Purity, are you there?
Yes. Good morning.
Morning. Thank you very much for calling us. Do you have a question for Daktari?
Nataka kuuliza swali.
Okay.
Niliambiwa niko na fibroids since 2009. Na from that time huwa nikipata mimba nakaa sana bila kupata mimba. Naweza maliza hata miaka 5 na nikikaa miezi 2 inatoka. Na sasa niliambiwa juzi, nimeenda hospitali nikaambiwa mpaka sasa zitolewe mpaka na uterus. Kwa hivyo nilikuwa nataka nipewe advice tu nitolewe ama nifanye nini. Na huwa haziumi. Lakini periods zangu zimekuwa irregular kabisa. Saa zingine inamaliza 2 months, saa zingine inamaliza 15 days, lakini haziumi.
Okay. And then umesema unakawia kabla upate mimba?
Sana kabisa. Mimi niko na mtoto mmoja kwa 22 years. Zingine ninabeba mimba inatoka after 2 months. Ile mimba nilibeba sana ilikaa 8 months, nikapata mtoto premature na akakufa after 3 weeks.
I'm sorry. All right, sawa. Thank you very much, Purity, for your question. And please stay with us because we need to take a break. But of course, when we come back, Dr. will answer all your questions as far as fibroids are concerned. So keep texting in your questions or calling. And of course, we'll try as much as possible and answer all of them before we end the show. So, all right, welcome back. We're in the last minutes of the show. Time really flies, but we're happy that you're still with us right here on Your World, where today our focus is on uterine fibroids. A lot of questions for Daktari, so let's just quickly jump into it. Daktari, 2 questions that we had before we went to break. So Eliza, sis went to a doctor. It's a lot, but I'm pretty sure you noted, and of course we were discussing some of, what could be the reason, and she's like, could this be fibroids maybe?
She mentioned, Lisa mentioned that she had a scan, so they should have picked up a fibroid if there was one.
Yeah.
Because the little cysts are not really connected to the fibroids, and a small cysts like that, they're usually normal actually.
Yeah.
That's just an egg forming in the ovary, which is normal. And every time you scan a woman, you're likely to get a cyst which grows up to even 5 centimeters, and they all dissolve by themselves, and another one forms the next cycle and things.
Yeah.
So there's something that I quite can't put together, but there could be something going on. She may just need to have a proper check so that we work out. But if an ultrasound scan was normal, it's unlikely she has fibroids, and I think she should be reassured.
Yeah.
Just check and find out.
Because you said a lot. I mean, she's not experiencing prolonged periods,
No.
which is a good thing. So just go get checked
I think
to ascertain
It
what
doesn't look
exactly
like it's a fibroid there.
is going on. And then for Purity's case as well, diagnosed with fibroids in 2009, but then again said over time takes too long before she gets pregnant. Once she gets pregnant, of course, 2 months, and she experiences a miscarriage. So she's like, what do I do? Have them removed or not? But I'm a bit concerned. 2009 up until now, they don't grow in size or in number. It's a lot. Questions that I have as far as Purity's case is concerned.
So Purity's case is quite a sad case actually. I think she should have something done before now.
Yeah.
Because fibroids, we know that they can delay your getting up, conceiving,
Yes.
because they actually, some of them sit inside the cavity where the baby is supposed to grow, and in that way you can't conceive. So it's like you're having some form of contraception actually in the way of a fibroid. And sometimes when you conceive, you end up losing that pregnancy, sometimes early, sometimes
only
a bit
2
later in the
months,
pregnancy actually, which is just sad.
Yeah.
So I think I suspect she requires an operation to remove the fibroids, not remove the womb.
Yeah.
She didn't indicate how old she is, but she just may need an operation to remove the fibroids.
And not
the
the
majority of
womb.
women who have such presentation actually get a baby after we do a mammectomy. A mammectomy is just removing the fibroids and leaving the womb intact. During mammectomy, there's a small risk of losing the womb because of bleeding and some things, but really that doesn't happen very frequently.
Yeah.
So the first thing for her would be a proper assessment of the fibroids, the number, the size, the site, where they are, whether they're on the lining.
Yeah.
Sometimes when the fibroids are actually just in the cavity alone, we can take away that. We call it hysteroscopically by passing a telescope through the neck of the womb and then just chipping it away.
Yeah.
That way it leaves a nice cavity because, as we said, the ones on top might just not be significant at all. She just may have a big fibroid sitting in the cavity
Yes.
and maybe not growing as fast,
Yeah.
but just actually destroying her chances of having a baby.
So not remove the uterus.
No,
No.
I think
Yeah.
it's better to be more conservative because it seems like she still wants babies.
Yes, yes. Okay. And it can be like a very, very painful, thing to even just think about that, removing your uterus and all those things. All right. And then we also have another caller, Purity from Nairobi. Good morning.
Good morning.
Thank you very much for calling us today, Purity. Do you have a question, a comment?
Okay, I have a question.
Go ahead.
Okay, I had the myomectomy process. Okay, and I have an issue. I also have blocked tubes. One of my tube is blocked, and getting pregnant is a bit hard. So I wanted to ask, is there any connection with the fibroids and the blocked tubes? Yeah, that was my question.
Okay. You don't have fibroids? You've not been diagnosed to have fibroids?
Okay, have been.
Oh, she had a myomectomy.
Yeah,
Okay,
yes.
okay. All right.
Yeah.
So, Dr. Is there a connection?
There could be a connection actually. I don't know what came before the other. Was there tube blocked before the myomectomy or not?
All right.
But
Purity, are you still on the line?
Yeah, I
All
am.
right. Yeah.
It's the fibroids.
Oh, the fibroids came before.
Yeah, I
Blocked
was
tube.
diagnosed with fibroids while I was 18. Yes.
Okay.
Now, but the blocked tubes I was diagnosed last year. Yes.
So they could be related. One of the commonest things that can happen at surgery is infection or just inflammation of the tubes. And sometimes the fibroid is actually where the tube is entering the uterus. And during the surgery, that can actually be affected by the surgery.
Okay.
As long as the fibroids are away, Purity still has a chance of having a baby actually. And you only need one tube to get a baby. So the chances of having a baby are still there. But it will be interesting to see at what point of the tube is blocked because you can also unblock the other tube. And sometimes time is against some women, and you need to act fast and make sure you make the right choice. So she can still conceive if the uterus is completely normal with one tube. because we have women who come with ectopics and we take away the tube deliberately actually so that the other one can function.
Yeah.
So we need to actually have a bit more information about which part of the tube is blocked and whether that can be salvaged.
Yeah, I don't know whether we're still on the line. Purity, are you still there?
Yeah, I'm still there.
Okay. All right. So do you know where exactly the blockage is?
Not really, but it's on the right side of one tube, on the right tube.
Okay.
Yes.
All right.
Is it at the end or the beginning of the tube?
And for that one, I'll have to confirm.
Okay.
Yeah.
So at the beginning it's not good. That could be the result of the surgery. But at the end, usually it could be just something, maybe adhesion or scarring from the operation. That can just be removed, and she has 2 functional tubes.
Okay.
So it needs a bit of more assessment.
Okay, so more assessment for you, Purity. But thank you very much for calling. Do you still have any other questions for Dr. or you're good for now?
Okay, thank you. I'm good.
All right.
Thank
Okay,
you.
appreciate it. Okay, so Dr. in terms of then treatments, because again, there's still a lot to talk about as far as treatment is concerned and the different treatment options that we have. Agatha, you mentioned that you went through myomectomy, right?
Yes.
And after that, you were told you need to get pregnant ASAP. Okay, so take us through the whole aspect of treatment process and why you were told, Agatha, pregnant now.
All right. So for myomectomy, because I wanted to conceive, so also the doctor was like, you're still young, you can conceive, so let's not go the hysterectomy way, the way Nani was being told all the time.
Yes.
So once that was done, my uterus was preserved. Yes.
Yeah.
So, but now the doctor is like, you need to get pregnant ASAP because they can recur again. So he was giving me a timeline of 6 months. I'm like, my sky itakuwa imeisha.
Yes.
Then he's like, by 3 months it's okay, but 6 months is best. When you push it too far, make it a year.
Yeah.
Otherwise, it might recur.
Yeah. Okay.
So that was the doctor's concern. But he's like, don't worry, you can have as many kids as you want. Yeah, it's not
just
a problem.
that we want to reduce the chances of recurrence.
Okay. And we're going to walk through this journey together. So.
Okay. All right. So, Dr. That aspect of like treatment options, do we have like other options aside from surgery? Because we also have a lot of women who are concerned about the same. Someone was asking, why is it that doctors always recommend surgery? Do we have like other options for the same? So, can we just start with the other options and then we'll talk about the surgery?
So it's interesting, actually. What my feeling here is that most doctors want to watch and wait.
Yes.
Because you don't want to really jump in and do surgery because you're actually just cutting your options to one.
Yeah.
So there are very many options available. I would actually maybe say 4 groups. One is just to wait and watch because women have different needs at different ages.
Yeah.
There's 18 when you are still in school, you really don't want anything and you're not really symptomatic. Leave it alone, it might not grow, it might grow. So watch and wait is reasonable. Things might change and you might do something. And then there's the first treatment option I would say is medical treatment, and there are 2 classes of medications for this. The first class is one that just takes care of the symptoms. The second helps shrink the fibroid. So the first group has medications like hemsabic acid. I think that's what you started on, to just limit the amount of bleeding. It makes you a bit clotty and reduces the amount of bleeding. Or drugs like brufen, which decrease the amount of hormones that the prostaglandins I talked about, the local hormones in the womb that make you bleed heavily and also have pain. This other type of medications is like the normal pill, either the combined pill or the progesterone-only pill.
Okay.
And as I said, that abolishes your normal internal hormones so that the fibroids are not stimulated to grow,
shrink
and you bleed less actually.
Yeah.
And there is a special coil called Mirena coil. It's a medicated coil which we insert inside the womb. It sits in the cavity and causes thinning of the lining. So most women don't bleed actually. So those are the options that reduce the symptoms.
Okay.
But then you have options that shrink the fibroid. Not really very useful in the long term, because if you're starting an 18-year-old on such treatment and you're expecting to go up to 35 when she's ready to have babies, it becomes very difficult to sustain the treatment. So a good example is a drug called Zoladex. When you inject that, it switches the woman into chemical menopause. It shuts off the ovaries.
Okay.
The good thing is that it's completely reversible.
Oh yeah, because I was concerned. I was like, what?
So
right.
they're completely reversible, but they're also licensed for 6 months. So we tend to use them in people who are close to menopause, maybe 48, 49, because you can actually suppress the symptoms for another 2 years, and then they go into menopause.
Okay.
There's a little drug called allopurinol acetate. Again, it suppresses progesterone. I think Fatima is on with hormones.
Yes. Yeah.
So you suppress progesterone, you actually stop them from growing. The second group of treatment would be radiological. So we have something called UFE, uterine fibroid embolization. In this one, a specialized doctor called a radiologist, interventional radiologist, actually passes a fine tube through the groin and tracks to the fibroid, the blood supply to the fibroid, and then they clog it, the blood supply with some material that stops blood into the fibroid. When you do that, the fibroid eventually shrinks because it dies off, it has no blood supply.
All right.
It's a newer mode of treatment, probably not very available in locally, but it's an option that women can have. Bit of concerns about it. One is that it can also affect the ovaries because you still have eggs in the ovary. So if you block the general direction of the ovary and kill some eggs, you can actually reduce the chances of fertility.
Yeah.
The second option is that there's a higher chance of re-intervention. So most people will require, not most, 1 in 3 will require another procedure over time.
Okay.
So that is offered where it's available, but again, we need to be aware that it has limitations.
Okay.
Then finally, surgery, actually.
Yes.
The one that
Elephant in the
everybody's
room. Yeah.
So
Yes.
unfortunately, the medical treatment and sitting and watching doesn't really take them away. So you can slow them from growing, but you won't take them away with anything at all. You can shrink them a bit, but when you stop treatment, they grow again.
Yeah.
So eventually, ultimately, you have to do some surgery, actually. Again, surgery depends on where they are, how big they are, your desire for fertility. So if you're finished family and you're 45 and they're really bothering you and they're big, just take away the whole uterus.
Yeah.
Hysterectomy. Easy. Associated with the highest satisfaction rate.
Okay.
But then in the middle here where you still have, you want babies, they're small, you think, oh, let's just take away the particular fibroid causing trouble and sit and wait and give you a chance to have a baby and things. So you can do myomectomy, which is just removing the fibroid from the tummy, the open way. I think that's what you went through because they were very big.
Yes.
So bikini line cut, we just take away the uterus and then pick one by one as you stitch the uterus. Associated with a lot of blood loss, usually because they are usually supplied to a lot of blood. And some people require transfusion like you did.
Yes, I got it.
Sometimes just blood boosters can pull you out of that.
Okay.
And sometimes you can do the keyhole one if they're small or they're few. So you put a telescope through the belly button and then you can shell them out one by one.
Okay.
If they're inside the cavity, you can actually remove them from below by passing a telescope and just chipping them away, as I said.
Yeah.
Eventually, you have a nice cavity and you can have babies. Or you can actually remove some of them if they're sitting on the cervix and you can see them from below. You can actually remove vaginal myomectomy.
Okay.
So that's the range of treatment options you have.
Okay. Hysterectomy.
It's actually usually the best if you have finished family because you have
you
no
do
worries
not.
about going back. A little small risk that if you take away the uterus, you also affect the life of the ovaries. So women tend to go into menopause a little bit earlier.
Yeah.
But at least you don't have any recurrence of the uterine fibroids.
Yes. Yeah.
Now the other ones that Fatima is mentioning elsewhere, those ones you can't get rid of them.
Yeah,
that way.
like breast fibroids. So my thinking is if you have a white carpet and then your child spills something on it, you don't cut it out and remove it. You're going to clean the carpet so that you can continue using it.
Doesn't matter how
So
long
that's
it is.
just my
Yes.
theory.
Yes.
And let me add the fact that I founded a platform, WellnessKE, so that I can give women this information because I feel like there are many women who have approached me who have had hysterectomies and now have breast fibroids.
Yeah.
So for me, I come from a point of why do you have the fibroids in the first place? If you can fix that, then you can fix everything else. And also, I feel like how God created us, every organ is supposed to function systematically.
Yeah.
So if one thing is not there, which I've seen women who have had complete hysterectomies, they do not have ovaries also, and it is causing havoc on their health, especially heart health. And so I feel like when you go to like Daktari, you have to have questions for him and ask him so that he can take you through the
Before
side
deciding
effects, if
which
it's
one,
medication, if it's whatever treatment option. And then even as you have done the treatment option, ask yourself, as I go back home, what changes am I making in my life to make sure I don't go back in that situation? That part is really important because nobody's going to tell you, now we've removed them, you're good to go.
Good to go.
No, you
Go
have to
ahead
make
and
sure that
have
you understand
babies.
why it
Yes.
was just you that
Yeah.
had the fibroids. Make the changes so that you don't end up there.
Yeah, and of
Yeah.
course your theory is all about like wholesome.
Yes,
you know,
wholesome,
approach
natural, and
towards this
holistic.
thing.
Because
Yeah.
the thing is, when we think about the fact that a woman's body is going to go through so many changes from puberty to pregnancy to everything, that means we can't necessarily control our environment, but we can control ourselves.
Oh, yeah.
So as Dr. had mentioned, if you are overweight, then how do you know you're
Make
overweight,
sure,
20% over the normal weight? Make sure that you have some physical activity. If you have stress, get rid of stress completely. If you don't eat healthy food, change that. Eat healthy food, check your iron levels, get a hormone test so that you can know, and also just make sure that every time every time you go for a checkup, you can be able to track your body, because Dr. will advise you, but then you also have to
Need to take all the necessary
Yes,
measures to
yes.
make sure that you're okay. All right. So after your surgery,
Yeah.
how were you in terms of like the whole healing process?
Yeah.
And up until now, how are you doing?
After my surgery, I would
Yeah.
say my healing was quite slow, because of scarring, I would say, because there were so many. And Dr. had asked me about that, and I was telling him, like, even when I would press my abdomen, I felt a lot of pain. So the healing was quite slow. And also, remember, as I mentioned, I had thrombosis.
Yeah.
So I had to heal from the blood clot and then also heal from the surgery. But I had to start off with my diet. That was the first thing. So I went vegan because I realized that eating a lot of red meat and all that was actually putting me at risk. And then I also had to make changes in terms of physical activity. I became more active. I also had to check my hormone levels constantly. So I discovered that every time I knew my levels, I would have different kinds of periods. For instance, if I don't check on my health, if I neglect my health for a month, that cycle will be a really tough one. So I'll have cramps, I'll have heavy flow, blah, blah, blah. But then if I make the changes, I actually have normal, just 2-3 days at most, and all
that's
that.
it. And
So
you
when
say
I
no
discovered
pain
that,
at
no
all.
pain at all, and also no inflammation, because the bloating and the inflammation really does cause a lot of stress to the body. So the changes have to come from a natural and holistic point. So make sure that when you're eating foods to balance your hormones, eat more cruciferous vegetables. That's your broccoli, cauliflower, cabbage. These are the foods that are going to help sweep the excess estrogen off your body.
Okay.
Also doing a liver cleanse, because you want to help support your liver so that it can keep removing the excess hormones and toxins from your body. So if you try and just make these natural steps, you'll find that there are huge changes in your body.
Okay. And then Agatha, for you, because Dr. I will still have a few questions for you in terms of people say when you have fibroids, it's important for you to get pregnant because pregnancy helps with the fibroids. It's a lot that I'll ask you. But Agatha, for you, your healing journey as well, how was it? Was it quick? Was it slow? And what are some of the changes that you had to make?
I could say mine was, okay, I felt it was fast.
Yeah.
Because I stayed 1 month at home, then I resumed work. But I was told not to do any strenuous activity because of the surgery.
Yeah.
So with time, I felt better. Then when my period came, they were so light. I was like so uncomfortable because I'm not I'm not used to having
Like, is there anything going on?
I'm not used to having light flow. No, it's very light. I'm uncomfortable. I'm finding myself standing up, wondering, have I soiled myself? Am I okay? I'm constantly going to the washroom to check if my pad is full or not. So at first it was a bit uncomfortable, but I came to adjust, and I'm like, wow, I'm happy now. Although I have cramps, but it's not as painful like
as
the way it used to be. And I've started exercising in the morning. I was like, let me sacrifice my sleep for 1 hour because I know I'm not a morning person. But actually, the doctor advised me to start once, like after 6 months, then I can start exercising. So I started at the beginning of the year because my surgery was last year in April. So I gave myself time. I didn't want to rush myself.
Take care of yourself.
Now starting doing physical exercises every morning and trying to eat more vegetables, less carbs, minimal amount of proteins, and just drinking water and all, drinking herbal tea. Like at times I can do raspberry, green tea, and all that.
So and that helps. Like now? How are you mentally, physically, emotionally? All those things combined.
Now I can say I'm okay.
Yes.
I'm happy with where I am,
Yes.
mentally, also physically,
Yeah.
because now I am losing weight. Not like the other time. I'm trying to exercising and
it is not
nothing.
going
Yeah,
away.
yes.
Yeah.
So
okay.
now I can say I am happy, and I'm looking forward to conceiving and carrying babies in future.
Yes. And of course, we wish you all the very best. We'll be here to be like,
Yeah,
you got it. You got it. Okay. So, Dr. a lot of questions. One had asked in terms of since fibroids reoccur, what can you do to prevent recurrence? And I think we can start with the risk of recurrence. Are there people who are more at risk of recurrence or not? And then that question of people say pregnancy can shrink small fibroids. Is this true?
Second one first, pregnancy doesn't actually shrink. As I mentioned earlier on, pregnancy you have more hormones, and some of them actually, fibroids tend to grow bigger.
Yeah.
And they undergo something called degeneration. It means they've grown too big for the blood supply, so they're actually dying off. So they cause a bit of pain in pregnancy. Majority are always silent in pregnancy,
Yeah.
but a small number will become painful. Usually we just treat with painkillers. Majority of women with fibroids will still have a normal natural birth.
Okay. And then the question of recurrence. What are the chances? And are there people who are more at risk of recurrences compared to others?
I think Fatma said a lot of nice things about healthy lifestyle. I think that's the beginning point. Actually, you can't emphasize that more. There are a lot of things that we are doing wrong, and a lot of estrogen that we are consuming from everywhere.
That we
Even
don't
the chicken
really
we are
need.
eating are
Yeah.
sexually fattened with using some steroids and things. So there's a lot in our environment. You have to go out of your way to make sure your kids are eating well and you're eating healthy as well. I think that would be the main point to make about prevention.
Okay.
Unfortunately, as I said before, fibroids could be there in different stages. Even if I removed 10 today, there could be a small one which can still grow.
Exactly.
So we always want to weigh that decision and individualize it to the client in front of you. So you are at 30 now, your requirements are this, and this is what you want. So it has to be that tailored to you. Otherwise, just looking at a fibroid and removing it is not going to solve a woman's problem. I said before, they can grow at a very fast rate, and they can grow at a small, slow rate. Some people get recurrence. Some people, once you take the single one that is there, that's the end of the story. Some people, you take them at 25, and at 35, you actually have another 10, and you have to go in and remove again because they still want to have babies and things. And some people have to take a hysterectomy quite early, maybe in their 20s, because she's finished family, and maybe they're just growing too fast, and you can't really cope with them, with the symptoms.
All right. But what about someone who, again, gets pregnant but still has fibroids, right? And that want to, again, carry the baby to term. So at what point do you then remove them? Or, again, it depends. You might want to remove them, sometimes not.
Good point, actually. So as I said, women can conceive with big fibroids, even as big as 10, 15 centimeters. And they carry a pregnancy, and they go into labor, and the uterus actually performs, and they have a natural baby. Sometimes fibroids can be obstructive. They can actually stop the baby from coming down, in which case then you are higher at risk of having a cesarean section or an operative delivery. And generally, because they're supplied with a lot of blood, we never touch them in pregnancy, and we don't touch them at delivery.
And they don't affect the baby throughout?
No. The babies usually grow, actually.
Okay.
So I think the other lady who had a small baby, I think a different reason for that. There may be a bit more going on in the background, actually. They usually don't limit the growth of the baby, and most babies are normal.
Okay.
So we need to look at other reasons. But generally speaking, because of the blood supply to the fibroid, if you touch it during delivery, it must really be coming in the way for you to remove it. Otherwise, they'll bleed like nothing, and you might end up with a delivery of the baby and a hysterectomy at the same time, which is a disaster.
Yes.
So we tend to leave them until 6 weeks afterwards. Then you can now schedule a mammectomy. Or if she has made it, then you can actually allow her to finish off family before you deal with them.
Okay. All right, Dr. So Agatha and Fatma, I'm only going to give you like 30 seconds each because we have to end the show in the next like 2 minutes to go. As far as then, having gone through this, right, and gone through the whole healing journey, surgery, and here you are right now, what would you tell women watching you and thinking, hi, Mimi? What would you say? Let's start with you, Agatha.
All right. So what I will tell women outside there, regular checkups is important. It's self-care, self-love. Do that for yourself. That is first of all, because now you'll understand what you're dealing with instead of sitting, suffering, and you do not know what you're dealing with. Another thing, if you're found with fibroids, don't despair. Be strong and go have a very good gynecologist. If you want to get a second and third opinion, go ahead until you get a satisfactory solution for yourself. If you want to preserve your uterus, if you want to remove your uterus, and stay healthy. Do more physical exercise. Watch what you eat. Yes, exactly. Do more vegetables. I know it can be yucky,
I know,
but let me tell you, it helps. So do more vegetables, do more smoothies, and if maybe and drink a lot of water, because at times I struggle, but I force myself to drink water. But all in all, things will be okay.
Things will be okay.
Should not despair.
I like that.
Stay strong.
I like that. Things will be okay. All right, Fatma.
Well, I would start off with hormones. Get your hormones checked regularly. Whenever you go into the hospital, make sure that you have like 5 good questions to ask your doctor about your treatment options, side effects, and how you can balance your hormones. Naturally find ways to stay healthy. If you are very confused, follow WellnessKE. We always have a gynecologist on board. We have questions that women send in so that they can be able to ask questions. And the one thing that women don't know is that the fact that stress actually does lead to some of these health conditions. So, and people say stress is something I can't control. No, you can. When it comes to your health, please make sure that you do. So focus on making sure that you de-stress. Always have an active lifestyle. Eat more cruciferous vegetables. Find recipes that are going to make them more delicious. As Agatha said, they might not be, but find that. And also get hormone checks. And most importantly, follow WellnessKE.
Okay. All right. And Dr. to just finish it all off, as far as uterine fibroids is concerned, what would you tell women, and even the men, as far as support, and just everyone in general, offering support to women, what would you say?
I think Agatha and Fatma have said very good points.
Very good points, yes.
Yeah, that you need regular checkups and you need to live healthy lifestyles. And lastly, you need to discuss with your doctor about your condition. There's never one way of dealing with a condition, and fibroids are the easiest things to deal with actually, as long as you understand your individual case. So when you visit your doctor, you must discuss thoroughly with them and understand what the options are. It's never you're never in a hurry, because as I said, they're innocent, so you can actually take your time about making that decision. And I think this is very useful. The sort of questions we've had is very useful, because I think what I'm hearing is that there's a need outside there, and women are looking for the answers. So the more support we give them, the better, actually. So you need to have a gyna, and you need to have somebody who can look after your health if you're not managing.
Okay. Thank you very much, Dr. Thank you very much to both ladies for coming by today. Very, very useful, and insightful conversation that we had today as far as uterine fibroids is concerned. So, of course, Agatha Lunju, TV producer right here at NTV, my producer for Health Diary. Thank you for coming by today. And, of course, Fatma Mohammed, founder WellnessKE as well. Thank you very much, Fatma, for coming by. And not forgetting Dr. Johnston Meheso, obstetrician and gynecologist. That name, obstetrician, is usually like a tough one for me to say. And of course, thank you very much, Dr. as well, for coming by today and just giving us all the answers that we need to have as far as fibroids is concerned. I know that you've learned a lot from today's episode, but takeaway message is get regular checkups as much as you can and ask all the questions that you have. So my name is Winnie Lubemba, wishing you a lovely day ahead. And like we always say, remember to stay safe and God bless. Thank you for watching. Goodbye.